This is CGTN, China Global Television Network.
Hello and welcome to China Global Television Network. This is The World Today. I'm Mahia Mutua in Nairobi. Here are your top stories. 12 workers are rescued from a flooded coal mine in northern China's Shaanxi province. Nearly 20 people are killed in a building fire in western Japan. And France bans non-essential travel to and from the UK amid fears of the Omicron variant. We begin with breaking news. Chinese authorities say 12 people have been lifted after being trapped underground for over 30 hours. The rescued are workers at a coal mine in northern China's Shaanxi. Authorities believe 21 of them were stranded when flooding occurred on Wednesday night. The first person was lifted at 2 p.m. local time. Our reporter Wang Mengjie reports from the rescue site.
Very excited and very exciting. The trapped miners are rescued, and rescue efforts are still on the way for other miners who have been trapped in a flooded coal mine for over 30 hours in North China's Shaanxi province. The local authorities said the rescuers have connected the trapped workers this morning. About 400 rescuers have been working around the clock to get them up. A police I've talked earlier told me that the timely rescue operation is a main reason why this time the trapped workers can be connected so soon, and one of them are lifted on right now. The city government set up an emergency rescue headquarters after the accident and has carried out the rescue work together with the local mine rescue team and firefighters. 2 pumps begun to drain water, and the water level has begun to drop. And because this is an illegal mine, that the site is hidden from the fences. So it's all unclear thing about the coal mine structure and the composition, which multiplies the difficulties for rescue work. And as you can hear beside me, the emergency cars are carrying the lifted rescuers here. So we're still waiting for other trapped workers who can be lifted at this moment.
Now, over a dozen people are feared killed in a fire that broke out in the Japanese city of Osaka. Local media reports that an elderly man brought a bag of flammable liquid into a psychiatry clinic, which then ignited. Police say an arson probe has been launched. Authorities are yet to announce an official death toll, but at least 27 people total are feared killed. The blaze erupted on the 4th floor of a 10-story building as business began for the day. It was mostly extinguished within half an hour. We will bring you the latest as more details emerge in that story. Moving on, China's political advisory body, the CPPCC, invited overseas Chinese representatives to an online meeting with people in the Xinjiang Uyghur Autonomous Region. Some of the attendees visited Xinjiang in October to see the region for themselves. Guo Tianqi has more.
25 overseas Chinese representatives from 19 countries on 5 continents communicated with the venue in Xinjiang. The participants in Xinjiang said their religious freedom and culture are protected and free education is universally available. Some of the overseas Chinese traveled to Xinjiang in October and used their own experience to refute claims of forced labor.
The cotton machine can collect cotton to the extent that equivalent to 2,000 manual laborers. When this machine is widely available, there is a need for the manual labor, let alone forced one.
They said every overseas Chinese is a diplomat who should learn more about China's current situation. Those who criticize human rights in Xinjiang should be invited to visit and see for themselves.
Seeing is believing. Only in this way they won't lie and won't put people into a pocket of deception only to satisfy their own goals.
During the meeting, the representatives in Xinjiang also spoke about their own experience of development in the region. People of Xinjiang have described the development they have witnessed themselves with the opportunity of Belt and Road Initiative. Xinjiang is full of confidence in the future. Guo Tianqi, CGTN, Beijing.
Well, the United States finally has a new ambassador to China. He is veteran diplomat Nicholas Burns. The vote in the U.S. Senate was 75 to 18 to confirm him. A senator from the opposition Republican Party had blocked the vote, leaving the post unfilled for 11 months. CGTN's Nathan King has more on Washington's new envoy to Beijing.
Nicholas Burns has been a visible figure on China, often appearing on CGTN and other global networks to weigh in on the most important bilateral relationship in the world.
All the transnational issues, pandemics, we can't do much without China. I think that balancing these two imperatives is going to be vital. It's complicated. We can't see them as the enemy because we need them.
Burns' emphasis has been on the cooperation possible between Washington and Beijing on the most pressing global issues. In the Biden administration, he will also have to focus on competition and confrontation with China too. Burns' selection as an ambassador would be a big win for diplomats over politicians. Burns has decades of experience as a diplomat in Africa, an expert on Russia, an ambassador to Greece and NATO. He was also the State Department spokesman and served on the National Security Council. The previous two ambassadors to Beijing have been politicians steeped in trade experience. Terry Branstad, the former governor of Iowa, who has known President Xi Jinping for decades, and Max Baucus, a former governor of Montana. Of course, Nicholas Burns was not the only candidate under consideration for the Beijing post. Charlene Barshevsky, the former trade representative who famously negotiated with Beijing over China's admission to the World Trade Organization, was widely reported to be in the running. But for that reason alone, her appointment would have been difficult due to the current anti-free trade climate in US politics. Nicholas Burns is a known quantity here in Washington, and in Beijing he's known as a safe pair of hands and an honest negotiator. But that necessarily won't be enough to warm relations between the US and China. As you know, relations probably haven't been this bad in the last 40 years. Nathan King, CGTN, Washington.
The UK has reported a record number of new COVID-19 cases for the second day. More than 88,000 daily infections were recorded on Thursday. The latest data come as the new Omicron variant continues to sweep across the country. Scores of schools and colleges in Britain are closing early for Christmas. Others are preparing for further disruption and possible closures next year. There is a fear that the latest surge could have a devastating impact on pubs and restaurants over the Christmas period. France is banning almost all travel to and from Britain, regardless of vaccination status. The French government says French citizens and EU nationals could still return from the UK, but they will need a negative COVID test within 24 hours and a blanket quarantine will be enforced upon arrival. Ross Cullen has more now from Paris.
What this move has prompted is a race to get back here to France before the restrictions come into effect on Saturday. That's the 18th of December. Speaking to some people in the UK this afternoon, one friend is rushing to try to get an earlier boat than she planned to be able to come back to France before Saturday. Another friend is in St Pancras right now. That's the terminal where Eurostar trains from Paris go into London, back and forth from St Pancras. She's in St Pancras, describes the scene as chaotic, as hundreds of people will be rushing to try to get any train they can to get back into Paris today or tomorrow. Think of all the French people in London, for example, wanting to spend Christmas with their families. Maybe they planned to come back to France at some point next week. Now they're rushing to try to come in before Saturday, because from Saturday, anybody coming in to France from the UK will have to be a French citizen, a French resident, or have an essential reason to be here, such as a customs agent, border force, police, hauliers, lorry drivers, people working in the embassy, for example, or students who are on an official university course. When you come into France, you have a 7-day quarantine period, whether you're French or not, whether you're vaccinated or not, whether you've had the booster or not. You can reduce that 7-day quarantine period to 2 days if you test negative in those first 2 days after you have arrived from the UK. Before you leave the UK, you will now also need a negative coronavirus test no older than 24 hours. Really, this sudden move, a drastic move, to use the words of the French government, but they feel they have no option because the situation in the UK is so perilous at the moment.
Malaysia is introducing new COVID restrictions ahead of the holidays after Omicron cases were detected in the country. The new restrictions come despite more than 95% of adults and 3/4 of the population being fully vaccinated. Rian Meltzer reports from Kuala Lumpur.
Malaysia's health minister warned the country to brace for a new wave of infections driven by the Omicron COVID variant, just as cases here have fallen to their lowest level in months. The minister announced that no big New Year's gatherings will now be allowed, and even those wishing to attend private holiday gatherings will need to do COVID self-tests first. The country will also ramp up its booster program by reopening mega vaccination centers used earlier in the year. So far, more than 4 million people have received boosters. And the health minister announced that everyone aged 60 and over, as well as those who received the Sinovac jab, will have to get a booster by the start of February or lose their fully vaccinated status, which is required for many activities. All this comes despite Malaysia's impressively high vaccination rate, and with daily COVID deaths less than 1/10 of their peak from August. Meanwhile, the government has extended the current parliamentary session to try to pass amendments Monday to the country's law aimed at controlling infectious diseases. The proposed changes include empowering authorities to require people under quarantine to wear electronic tracking devices and sharply increasing fines or even imposing jail terms on individuals and companies that break health regulations. Ryan Meltzer, CGTN, Kuala Lumpur.
And that's it for this edition of The World Today. Angelo Coppola in Johannesburg, Patrick Oyet in Juba, as well as Tessem Akende in Jos are all standing by to bring you some of the top stories making headlines across Africa. That's coming up next on Africa Live. Do stay with us.
This is CGTN, China Global Television Network.
A small study of South African COVID patients shows that the Omicron variant can break through booster shots. UN Secretary General Antonio Guterres calls for coordinated efforts to end the pandemic, and the UN Human Rights Council to hold a session on the Ethiopian conflict at the EU's request. Hello and welcome to Africa Live, only on CGTN. I'm Mahia Mutua in Nairobi. Also coming up, in business, Africa banking on its oil industry despite global clean energy transition. And in sports, the Confederation of African Football adamant that the Africa Cup of Nations will go ahead as planned. Welcome to the program. We begin in South Africa, where a study of 7 COVID-19 cases there shows the Omicron variant can break through booster vaccine shots. According to a scientist involved in the study, 6 out of the 7 cases were fully vaccinated. Of the 6, 5 had also had a booster shot. The findings are currently under peer review. A much bigger study of 581 people in Britain shows booster vaccines significantly restore protection against mild disease caused by the Omicron variant. That was revealed by the UK Health Security Agency last week. This even as health authorities in South Africa say lockdown restrictions have been retained at adjusted level 1 in light of a spike in cases. South Africa has been the worst affected country by the pandemic on the African continent. Well, let's get more insight into that. CGTN's Angelo Coppola is in Johannesburg and joins us live now. Angelo, what more can you tell us about this study?
Well, Mahia, you've said it. It's all about booster shots and the fact that each of those patients had different permutations of the vaccine and booster shots. So we know from results of some research that was done in South Africa that the reinfection rates from Omicron were actually higher than for any other earlier variant. But importantly, the severity rate, and there are lower symptoms which are also milder. So we also know that the vaccines were found to be less effective against Omicron, although some data has suggested that a booster shot might mitigate against the risk of getting serious infection from the virus. Admittedly, though, this is a small study. There are only 7 people involved, and it still needs to be peer-reviewed. But it does raise some concerns. Medical experts keep reminding us, though, that the vaccines aren't there to prevent getting the virus. It's about limiting the severity of the disease and keeping people out of hospital. So more research is needed to get a viable sample size. I mean, if you compare it to the 581 sample size in the UK, which came out with different findings, you can see there's still a lot of research that needs to be done, and before any kind of course of action are taken. So there have been increased calls, in fact, for an updated vaccine, and something that the vaccine suppliers around the world are no doubt working on. Mahia.
And Angelo, what can you tell us is the latest on COVID in the country, and why did the National Coronavirus Command Council retain lockdown restrictions at adjusted level 1?
Well, the messages we're getting from that NCCC, that's the National Coronavirus Command Council, and from the Health Minister and from the Acting President are that the authorities aren't concerned just yet. That's the message we're receiving. In fact, that meeting with the NCCC was held on Wednesday, and the Council said they wouldn't be changing that lockdown level despite the country now at its 4th wave, with Gauteng trending downwards and the coastal provinces spiking in terms of infections. Infection numbers and positivity rates are near record levels, but those death rates are still relatively low. So experts are saying that there's a decoupling between cases, hospitalizations and deaths. However, there was some concern about healthcare workers and the fact that they're being infected and having to self-isolate, which means that they can't be in hospital manning those beds that are needed. So, and that's despite the severity of the infection rates being lower. And this is putting strain on those hospitals and admissions, obviously. Joe Pata, the health minister, has also urged the public to vaccinate, sanitize, maintain social distancing, and as they go away on holiday, to stay away from indoor events. So he's going to be watching what's happening with those death rates but no further action from authorities about changing or imposing those harsher lockdown levels that we saw last year, Mahia.
All right, Angelo, thank you very much for bringing us the latest from South Africa. CGTN's Angelo Coppola there in Johannesburg. Moving on, 98 countries have yet to meet the World Health Organization target to vaccinate 40% of people globally by the end of the year. United Nations Secretary General Antonio Guterres says the world cannot defeat the coronavirus pandemic in an uncoordinated way. CGTN's Joy Kiruki-Juma reports.
It is only days away from the global deadline to vaccinate 40% of people. Yet Africa has the lowest share of the population that is fully vaccinated, at just 7% according to the Africa CDC. This is a scenario that has the UN Secretary General concerned.
At current rates, Africa will not meet the 70% threshold until August 2024. So vaccine inequity is giving variants a free pass to run wild, ravaging the health of people and economies in every corner of the globe. We cannot defeat the pandemic in an uncoordinated way.
According to Guterres, vaccines alone will not eradicate the pandemic.
Vaccines are averting hospitalization and deaths for the majority who get them and slowing the spread. But transmissions show no sign of letting up. And this is driven by vaccine inequity, hesitancy, and complacency.
The Secretary General also denounced lopsided recovery efforts that are accelerating inequalities and increasing stresses on economies and societies.
Defaults will become inevitable for lower-income countries that already bear much higher borrowing costs. And the need to service an ever-mounting and more expensive debt will leave developing countries with little fiscal space for recovery, job creation, climate action, reimagining education and reskilling and training workers, and so much more. It is time to clearly assume the need for reform of the international financial system.
The United Nations has termed the coronavirus pandemic as more than a health crisis. Vaccine and financial inequalities have only gone to expose what needs to be done. Joy Kiruki-Juma, CGTN.
Now, the first conference on public health in Africa has just concluded. The three-day event brought together over 140 African policymakers, civil society representatives, scientists, and other experts. The conference was co-hosted by the AU and Africa CDC. Tackling vaccine inequity and strengthening Africa's health systems were on the main agenda. AUC chairperson Musa Faki Mahamat called for continental collaboration to bolster Africa's capacity to manufacture vaccines. He also stressed the need to expand the public health workforce. This year's event was held virtually with plans to hold the conference in Rwanda next year. Well, let's get more insights into that story. We're now joined from Nairobi by Dr. Rispa Walumbe, a health policy advisor at AMREF. Dr. Stakeholders are calling for a new public health order to address health challenges on the continent. What are your thoughts on this proposal?
So thank you so much, and thanks again for the opportunity to be here. I think when you just listen to the sidelines of CIFIA and all the work that has gone into the preparation and the thought process behind it, I think that the deliberations you're hearing at this inaugural conference, the first of its kind for Africa, really does show how we're trying to learn from this pandemic and also past experiences to ensure that Africa is really equipped to be able to navigate future crises, whether they're in a pandemic form or in any other form, through stronger collaboration, just as was elaborated by, of course, Musa Faki. And I think that's something the new public health order kind of encompasses this very well, because it tackles various issues, and I think it's really a concrete way for everyone to rally around the work of Africa Union, the Africa CDC, because of course the Africa CDC really is kind of like the spearheading of all that, the new public health order. So I think it's a strong approach to be able to make sure that we can rally together, use that collaboration, and use the new public health order platform as a way for us to just have stronger and more resilient systems for healthcare.
And Doctor, looking deeper into this undertaking, the proposal of it, how would such a public health order work?
Thanks so much. I think when you're looking at the new public health order, because it's something quite new, right? Just in its name, but also in its inception, in its thought process. And this was something that was actually born prior to the pandemic, right? So there were already thought processes going on around this. And I think the pandemic kind of just honed us into certain areas, right? So of course, we've looked at issues to do with health system strengthening. And this is something that a lot of public health specialists, a lot of public health experts have been thinking around and really looking at the context of Africa and what does this really look like? So in terms of just actionable things that can happen, I think it's about leveraging the existing mechanisms that are at a regional and national level. And this includes things like the Africa Continental Free Trade Agreement and really figuring out how do we implement this. That's going to be through collaborations with both public and private actors and sitting down and seeing how do we create a win-win situation that is effective and actually ensures commodity security, but also enables economic growth, right? And I think the AFCFTA being implemented is a really important step as one of the examples. Another example that the new public health order elaborates on is really looking at strengthening public health institutions. Through the guidance of course, the Africa CDC, public health institutions are responsible for guiding us through our global health security measures, ensuring that we uphold the regulations, the international health regulations from 2005, and really making sure that they are actionable for countries. And we're strengthening country capability to be able to enhance surveillance, enhance health workforce training. And this is not just, looking at health workforce in terms of those within healthcare facilities, but it's also looking at epidemiologists, it's looking at lab teams who are in the field, who are ensuring that we're able to keep this surveillance going and we're able to action it. And I think that's one of the strongest ways that we can just move forward. These are just some of the examples, but there's quite a bit that has been elaborated at the conference and also prior to the conference and how we can take this forward. But I think those deliberations really look to ensuring we have commodity security, which of course includes vaccines, right? We want to be able to make sure that we as a continent are resilient and effective in terms of how we are able to fend for ourselves, so to speak, not just in the healthcare system, but also just in terms of our economy as an entire continent, and also at the national level.
Right.
And I think this is the approach that will make sure that we're really collaborating together, because I think at the heart of the new public health order is that collaborating across countries and across the region.
Right. Doctor, thank you very much for breaking that down for us here on Africa Live. Dr. Rispa Walumbe, who's a health policy advisor at AMREF, joining us live from Nairobi. Moving on, at least 80 people have died from Lassa fever in Nigeria. The Nigeria Center for Disease Control says 434 cases have so far been confirmed. The NCDC says it is scaling up efforts to tackle the outbreak. This includes activating emergency operations to allow for proper surveillance of the disease. Lassa fever is spread to humans from rodent excrement. Well, CGTN's Tessem Akende joins us live from Jos with more. Tessem, what is the latest on the Lassa fever outbreak in the country?
Yeah, the latest is that 80 people, like you've just read, have died from Lassa fever-related concerns this year. That's from 434 who have cases that have been reported this year alone. That's from health authorities from the National Nigeria Center for Disease Control. And they've been working hard to ensure that these figures do not get beyond what it is at the moment. The reports also indicate that this is not peculiar to Nigeria, but other countries, especially within the West African region, saying that the disease is actually endemic. Most of these cases, by the report or by the authorities, happens between May and November during the dry season. Of course, we're in the dry season here in Nigeria. So this is the latest at the moment, as has been reported or released by authorities from the Nigeria Center for Disease Control.
And Tessem, how would you say that the government and partners are managing the situation?
Well, about 7 laboratories have been set up by the government to encourage testing and to also encourage, to facilitate and help detection of people, with the cases. And so it has been doing this since 2016. But for these laboratories, perhaps these situations would have, gotten worse. And so that is happening at the moment. Also, the authorities from the Nigerian Center for Disease Control are also participating in an ongoing research at the moment to, find a cure, to actually get to the root of, a cure for and vaccine for Lassa fever, not just in Nigeria, but of course the entire African continent. So this is ongoing at the moment. It's actually a research that is, not only Nigeria is, carrying out this research, but other countries within the, on the African continent. So this is ongoing, and health authorities in Nigeria here hope that this will yield results and cases of Lassa fever, especially as we get into the new year, will reduce drastically.
Tessem, thank you very much for that. CGTN's Tessem Akende in Jos, Nigeria. Moving on, Libyans are in the dark as to whether the 24th of December elections will proceed as planned. The presidential and parliamentary polls were meant to help end Libya's past decade of chaos. This was to be achieved by installing a political leadership with national legitimacy after years of factional division. The process has, however, been dogged by bitter disputes over the election's legal basis and fundamental rules. Earlier, the Electoral Commission said it would not release the list of eligible candidates until legal discussions with the judiciary and parliament are had.
As Libyans, we only demand the organization of elections for better times, not for worse. The most important thing is that we do not want war, even if things escalate.
There is the determination to have the Libyan elections on December 24 and for it to reflect what the Libyan people want.
Well, for more on that, we're now joined by Amira El Sayed, who's a political analyst as well as a writer and editor at the Egyptian Gazette based in Cairo. Amira, as it stands, the vote looks highly unlikely. What do you think will be the impact?
Actually, in the light of the recent developments in the political scene in Libya, we can say that the presidential election, they face uncertainty amid towering challenges. And actually now Libya is on bumpy road. Till now, the final list of the candidates hasn't been announced. This means that the candidates will not have enough time to launch their campaigns. We are talking about the election should be organized or held within a week. So there is no enough time. Even the climate or the environment in Libya is not adequately prepared to have free, fair and inclusive elections, as Libya remains deeply, we can say, divided. So even if the elections will be held on its time, it's very difficult to accept the results of these elections. So the elections could lead to further destabilization and violence in Libya, especially that there are some controversial candidates like Haftar or Saif al-Qaddafi or Dibeiba. Also, we have seen that the UN Special Envoy to Libya abruptly resigns a month before the elections, a matter that we can say deal a serious blow to the international efforts that seek to have the elections on time. So in light of all these developments, we can say that it's hardly to hold the elections on time. But does this mean that this is the ideal option to postpone the elections? Actually not, because also not having the election on time will give an indication or significance that power or militias are the only way to reach power. So unfortunately now Libya is in dire straits, and now we are choosing the lesser between two evils, because Libya, as I mentioned, is now in dire straits. But in light of all these developments, I think that the elections will be most likely postponed.
Well, that was Amira El Sayed, a political analyst, joining us live there from Cairo. Moving on, turning to South Sudan, and the country continues to deal with devastating floods. In Unity State, authorities say flooding has left over 90% of the population homeless. The entire population of Unity State currently depends on food aid. Floods have also washed away crops, heavily impacting livelihoods. Aid agencies are calling for more support in efforts to mitigate the devastation. CGTN's Patrick Oyet has just returned from Juba after spending some time in Bentiu. He joins us live now for more. Patrick, what can you tell us about the latest on the situation on the ground there in Bentiu?
Yeah, Mahia, as you just said, we've just returned to Juba, and the situation in Bentiu is that right now, Bentiu does not look like a place that people used to stay in. What you see there is like Bentiu is an island in the middle of an ocean, because everywhere there is water, and they struggle to keep the water away from the few camps that have been set up to keep those displaced. Is an everyday work. The dikes have been built to try to block the water. The dikes some are as tall as I am, some are even taller than me, to prevent the water from breaking into where people are really staying. Crops are washed away, livestock are washed away. People who have survived have just come to the display centers with nothing in their hands. The only thing they have is fish and the food that they get from aid agencies. And then life is really very difficult for anyone there. They are trapped. There is no road transport anymore. The airport is surrounded by water, and the only means of transport is just the canoes that people move within the areas that they used to call home, but now is all in water.
And Patrick, from what you saw, how are the government and its partners managing the situation?
Yeah, first of all, the monitoring of the water levels is an everyday job, 24/7. The government, and especially the United Nations mission in South Sudan, is moving also all over the place, trying to really monitor the water levels, because occasionally the dikes break and then they have to be filled immediately so that the water doesn't overrun the town. The town is just remaining very small, and so that is one thing they are doing to make sure that the water doesn't break into where people are, and also to keep the airport at least functioning, because the water has surrounded the airport. It's just actually at the airport, just blocked by the dikes. So the UN agencies are there trying to always continue heaping more soil to block the water from coming. And the worst thing is that the levels continue to rise. And then also, there is no rain. This water is just coming from where the local people there cannot tell you where the water is coming from, but it just keeps coming. So that's one thing that the aid agencies are doing. Another thing is aid agencies like UNICEF, they are providing mobile schools where the displaced are. They put the tents, try to build some makeshift classrooms. If the place is overrun by water, they move the tent to another place. So, and also providing the food to the children and women who are there. So things are really difficult there, and the government and aid agencies are trying, but they're also crying for more help. They're saying they need more support in order to support the displaced people who have run because of the flooding.
All right, Patrick, thank you very much for your insights. CGTN's Patrick Oyet speaking to us from Juba. Well, it's time for us to take a short break. Here's what's coming up on the program. The UN Human Rights Council to hold session on Ethiopia conflict at the EU's request. And we look at how Uganda's trial program uses drones to deliver HIV medication to a remote archipelago. Welcome back. You're watching Africa Live. Now, the United Nations Human Rights Council will hold an urgent session on Ethiopia amid reports of further atrocities in the Tigray region. The session was requested by the EU and will take place on Friday. It will decide whether a team should be sent to investigate human rights violations. Both the Ethiopian government and the TPLF face accusations of carrying out atrocities which may amount to war crimes. Ethiopia has dismissed the move as politically motivated. Well, for more on that, we're now joined by CGTN's Girum Chala in Addis Ababa for more. Girum, how has the government reacted to the European Union's request to the UNHRC to hold a special session on the situation there in the country?
Maya, there is a statement from the Ethiopian Ministry of Foreign Affairs rejecting the proposal of this meeting, the special session that is intended to talk about the Ethiopian northern conflict, human rights situation, more particularly in the Tigray regional state. The government, as you said, named it, this is a politically motivated session and it should not be held. The statement also said that all member states of the Human Rights Council should reject it categorically, as this is not intended to perhaps expedite the process of investigation on the ground, for which Ethiopia is saying that it has been collaborating with the UN Human Rights Council and the others, and that process has been stopped in order to gain some politically motivated outcomes after this special session. So Ethiopia is rejecting it. It wants member states to reject it. Most African states, by the way, did not sign up for this meeting or did not call for it. As you said, it was called by the European Union to talk about an African issue, as the statement also continued talking about. So in general terms, Ethiopia is not happy with the meeting and wants member states not to also accept whatever comes out of it.
And Girum, as it stands, what's the situation like in the north?
Well, Maya, unfortunately, war is in continuation in the north, in a place called Gashana, where the Tigray and Amhara states, regional states, are meeting or neighboring each other too. There is now an intensified gun battle happening to hold that strategic location. That location also enables you to go to the north, to the Tigray regional state, or easily go to the western part of the country, which TPLF wants to open the Sudan border itself. So the Ethiopian National Defense Force are saying that TPLF is unable to cross anywhere. They are encircled and they are still demanding for them to surrender their weapons and also stop the war. Otherwise, the NDF is promising that it is going to finish the job of at least taking the Tigray force out of the Amhara regional state. As you remember, the Afar regional state is now completely free of the rebel force. On the other hand, TPLF is accusing the government of several drone attacks which killed scores of people. According to some, these are civilians, but the government is denying that whatever airstrike or drone strike that was staged aimed at destroying militarily important locations, not civilians. So they have also denied that. So in general terms, war in the north, more particularly border areas of the Amhara and the Tigray regional state, is continuing. The other parts of the country seems to be coming back to normalcy after they were freed by the Ethiopian National Defense Force.
All right, Girum, thank you very much for speaking to us. Girum Chala joining us live there from Addis Ababa. Well, staying in East Africa and turning to Uganda, where a new program is using drones to deliver HIV drugs to a remote archipelago on Lake Victoria. Asta Tal has more.
This is Kangala, an 84-island archipelago on Lake Victoria. Its location makes it difficult to deliver much-needed medication, in particular drugs used for the treatment of HIV. Kangala's population has a soaring HIV rate. About 27% of the island's population has the virus. Before, medication used to be delivered via boats, which presented its own challenge.
I personally have also been here in Kalangala for the last 4 years. I had also faced a lot of challenges to the point of almost drowning in water. So the drones project was actually brought to Kalangala to overcome the geographical challenges that are faced by the health workers together with the patients, mostly HIV positive patients.
The trial is being run by the Ugandan government's Infectious Diseases Institute, with funding coming from Johnson & Johnson. It looks to improve the transport of medical supplies for the country's health system.
Once we have gathered the data and analysed,
We also then hope to use that to say whether we could set up a regular service around the islands to the whole of Kalangala district, or other places in Uganda or indeed East Africa which are difficult to reach, such as long distance areas with difficult terrain, maybe in West Nile district. We also are looking at putting other things in the drone. Because the drone lands, it can be loaded with samples. So maybe we can test for HIV viral load, maybe we can look at TB samples. We're also starting to look at COVID samples in the West Nile region.
The team also plans to see if in the future testing samples for tuberculosis and COVID samples can be sent via drones. Astatal, CGTN.
Now, despite the global movement towards more green energy, Africa is still banking on its oil and gas to drive industrialization. Both political leaders and economic experts say revenues from oil and gas are crucial to bring about the kind of development economies on the continent need. Deji Bademosi reports from the continent's largest oil producer, which is still heavily dependent on crude oil and gas for most of the cash needed to run the federal government.
If there's need for any evidence that Africa's largest oil producer is still very much counting on its oil to drive its economy, then this is it. It's a 650,000 barrels per day Dangote refinery in the Lekki Free Trade Zone area of Lagos. It's the largest single-train oil refinery in the world.
By the time the refinery begins production by around June, latest July next year, that is going to be a major saver for foreign exchange for our country, and we think we will export those refined products.
Like Nigeria, many other African countries produce oil as well. Experts believe oil is likely to dominate trade under the Africa Continental Free Trade Area Initiative.
If you realize that oil and gas is a major contributor to revenues in the African continent, especially look at Angola, look at Nigeria, look at Ghana, and other oil-producing countries, what it does is that it allows for that whole business to be able to expand in the African economy. And the ability to trade within countries in terms of oil and gas, the ease of movement of persons and products. You look at what is happening in Nigeria with Dangote refinery. You look at what is happening in Angola, upping their production. So you have ability to move across border lines in terms of products of oil and gas is huge, and the potentials are huge. And then what you're going to find is that the effect on that on the GDP of Africa and GDP of the nations that are oil producing will be on the upward trend.
While the world's attention has been focused on renewable energy lately, Africa is still focused on expanding investments in its oil and gas industry.
We are not really in the race to renewables as a country, and even as a continent, we are not really very much in the race to renewables. Let's look at where we have our comparative advantage. Our comparative advantage today, as far as energy is concerned, is in the area of oil and gas.
The truth of the matter is that poverty is real, the hunger is real, the need is real in Africa. And if we have natural resources that can help us curb those, then we must begin to do that. Maybe perhaps what we should do is also to begin to trade carbon credits and look for how we can use carbon credits to offset some of the emissions that could happen based on fossil fuel.
Beyond the Nigerian market, the Dangote refinery is hoping to leverage the AFCTA to become the leading supplier of petroleum products on the continent. The Nigerian government also has its eye on the pie as well. It is currently carrying out rehabilitation work on its refineries, hoping to also take advantage of the AFCTA and become a net exporter of refined petrol in the future. Deji Bademasi, CGTN, Lagos, Nigeria.
Well, it's just about time for all the sport here on Africa Live. Here's what's coming up. The Confederation of African Football adamant that the African